The Respiclick is a dry powder inhaler, or DPI, that contains multiple doses of medication within this case. Before using the Respiclick, make sure the cap over the mouthpiece is closed and that the counter shows available doses. Do not prime this device. Wait until you're ready to take the dose before opening the cap, because once the cap is opened, a dose is loaded and ready to be inhaled. Hold the Respiclick upright and open the cap completely until you hear a click like this. This exposes the mouthpiece and the air vents and loads the medication. Never shake the device because the fine dry powder may spill out. If you accidentally drop it after loading the dose, then you must start over because the powder likely spilled. Holding the Respiclick with one hand but away from your mouth, breathe out gently but completely. Never exhale into the Respiclick because you may blow out the powder. After exhaling away from the device, seal your lips around the mouthpiece, but do not cover the air vents with your lips or fingers. Do not use a spacer with the Respiclick. Breathe in quickly and deeply through your mouth until you take a full deep breath. Looks like this. Move the device away from your mouth and hold your breath for up to 10 seconds or as long as possible. Then breathe out slowly. Close the cover firmly over the mouthpiece and make sure it clicks shut like this. If a second dose is needed, repeat the steps above, starting with holding the device upright and opening the cap so the medicine will be loaded and ready to be inhaled. If the Respiclick contains an inhaled corticosteroid, rinse your mouth, gargle and spit, do not swallow, to reduce the risk of a fungus called thrush.